So, if gravity is starting to take effect and somebody thinks that they have a little sagginess or droopiness, perhaps maybe thinks she might need a lift, how does she go about knowing what she needs?
Well, it's interesting that you asked that, Lauren, because almost every woman that comes into my office, even if she's not droopy, thinks she needs a lift. And they're very reassured when they find out that they don't. You know, women who even are starting Perky, they feel like they're a little droopy. Can you make me perkier? So the answer is they don't need a lift, and they look great with an implant alone. Now, some women are mildly droopy and are also pleased to find out that they don't need a lift, because sometimes an implant alone will give the illusion of a lift. Because if you fill the patient on the top as well as below, it makes it look like the breast has come up, and it gives the illusion that the nipple is higher and a lift. The measurements are still the same. There's no actual lift, but it gives that good illusion. Now, women who need a lift, they can do a pencil test at home, which means that they look in a mirror and they put a pencil in the crease underneath their breast. If the nipple is below that crease, those women need a lift, because if a woman said, I want an implant and that will help, then actually their breast will still be sort of hanging off the bottom of that implant afterwards. So they actually need a lift. And the lift moves the position of the nipple higher without taking it off, just sewing it higher. We tighten some of the loose skin from underneath, and the skin that's on either side of their breast is brought underneath to make like a new bra of their own tissue.
Okay.
So the scar goes around the nipple. This is for moderate to severe droopiness. Around the nipple, down and underneath the breast. Sometimes a woman is not sure if she wants an implant or not. So I ask the question, when you're looking in a mirror and you're in a good bra, are you happy with the size of your breasts, or do you wish they were a little fuller? And if they say, well, I wish I were a little fuller, maybe a little bigger, well, those are the patients that also need a breast implant. So then we do the implant first, and it fills out the breast, and then I tighten up the skin around the enlarged breast.
Okay. So is a woman able to get a breast lift and an implant in the same surgery?
Absolutely. And women are very happy to find out that that's possible, because it'll save them 2 operations. In the past, many surgeons would first recommend doing a lift first, and then several months later doing the augmentation or the implant. So it is possible and safe to do the enlargement and the lift at the same time. I've actually created a new approach to this, and I nicknamed it the Ideal Breast Lift for improved design, Eisenberg augmentation lift, Ideal. I published this, and I'm teaching doctors from around the world this approach for breast lift and augmentation at the same time. So yes, other surgeons are doing augmentation and lift at the same time, and I think it's a great procedure, and it saves a patient a second surgery, and it's very safe.